Canine pancreatitis is a common and challenging inflammatory disease that can be difficult to diagnose and manage in veterinary practice. The condition presents as a spectrum from mild to severe and can be acute, which is potentially reversible, or chronic, involving irreversible changes like fibrosis and acinar cell loss. Definitive diagnosis requires histopathology, but this is rarely performed due to its invasive nature. Consequently, veterinarians typically make a presumptive diagnosis based on a combination of nonspecific clinical signs, such as vomiting, anorexia, and abdominal pain, laboratory tests, and diagnostic imaging. Advances in diagnostics have shifted from less specific serum amylase and lipase activity tests to immunoassays that measure canine pancreatic lipase, CPL, a more specific biomarker for pancreatic inflammation. Various commercial CPL assays are available, including the lab-based SPEC-CPL and point-of-care tests like SNAP-CPL and JEC-CPL, which have shown near-perfect agreement and strong correlation with each other, making them valuable for both initial diagnosis and monitoring. Abdominal ultrasound is the preferred imaging modality, though its sensitivity for detecting pancreatitis can be highly variable and operator-dependent. A significant concern is the interplay between pancreatitis and diabetes mellitus, DM, as inflammation of the exocrine pancreas can cause bystander damage to the adjacent insulin-producing beta cells, leading to DM. Postmortem studies show that up to 30% of diabetic dogs have concurrent evidence of pancreatitis. While the exact cause of pancreatitis is often unknown, it is considered a complex disease arising from an interaction between genetic predispositions and environmental factors, such as diet and concurrent endocrinopathies. Historically, treatment has been limited to supportive care, including fluid therapy, pain management, antiemetics, and nutritional support. However, novel therapies are emerging that target the underlying pathophysiology. Fusiplatinib, a leukocyte activation inhibitor, has been shown to be safe and to improve clinical activity scores by reducing neutrophil migration into the pancreas. Another promising treatment is membrane-free stem cell extract, MF-STEM, an anti-inflammatory therapy that demonstrated a dramatic increase in survival rate from 46% to 92% in a clinical study of dogs with pancreatitis.